Hello, my name is Fiona Bengo, and today I'm going to talk about a topic called health literacy. So on this next slide I have the outline in which it contains all the topics that I'm going to talk about. So the first topic will be meaning of health literacy. Then the next will be how health literacy affects patient nutrition. The next one will be how health literacy affects prescription medicine use. Then how health literacy affects preventive care, and then I'll make a conclusion. Then I'll give you some of the references you can use later. So it's better first of all to know the meaning of health literacy. So what is the meaning of health literacy? So health literacy means that the level at which individuals have the ability to get, understand and perform basic health information and services needed to make appropriate health decisions. So this can be a degree of how people can be able to have the ability to understand and maybe comprehend health information and make appropriate health decisions. So health literacy can affect the patient's health outcome. So let me first of all talk about an example of how health literacy can affect patients' nutrition. So health literacy gives difficulty to express their nutrition concerns. So, and another thing is that a lot of patients do not have the ability to identify foods high in saturated or saturated fat, or how to group the foods. So that is how health illiteracy affects their patients' outcomes. So they end up getting a lot of diseases which affect them, and they might even end up dead. So in this next slide we have how health literacy affects prescription medicine use. So the prescription medicine use, this is why a doctor gives you some medicine and some instructions on how to follow them. So how health literacy affects it is that if someone is illiterate, they have decreased knowledge and understanding on how to use that medicine. Also, there is the decreased ability for medication management. For example, for someone who has diabetes, so for the one who is health illiterate, they won't be able to manage the medication because they use a lot of medicines, and they cannot be able to finish it because they don't know where to start and when to end it. So the next one is increased healthcare costs. So this comes up because most of the illiterate, those ones who are health illiterate, they normally go to the hospitals when they are very sick. Instead of finding a way of preventing them, they just go to the hospital during that time. So it costs them a lot. That's why that is how health literacy affects prescription medicine use. So the next topic is about how health literacy affects preventive care. So health literacy, so if someone is illiterate, it gives them a difficulty in calculating cholesterol and blood sugar level. So as you know, high cholesterol affects people, so it brings about some diseases such as cancer or diabetes. So when someone wants maybe to prevent it, and they are illiterate in health terms, so they won't be able to calculate it. As one of the skills for one to be health literate, they have to have the skill of numeracy. So by this I mean maybe calculating things mathematically. So the next one is increase in preventable hospital visits and admissions. As earlier I talked about, where those people, they go to hospital when they get sicker, instead of just going to the hospital visiting just for checkups, even if they are not sick, but just for checkup to prevent those hospital visits and admissions. Also on this one, it increases costs. So as I've told you, they go when they are more sicker, and then they have to buy a lot of medicines, and also they have to use some emergency services. So the next one is inability to choose a healthier lifestyle. So when you are health illiterate, you won't know the types of foods which can promote a healthier lifestyle and the ones which cannot promote a healthier lifestyle. So it gives them a hard time to know the ones which they can use. So that is how health literacy affects preventive care. So we are coming to the end of the presentation. So I have a small conclusion here. So the primary responsibility for improving health literacy lies with public health professionals and the healthcare and public health system. So this cannot be, health literacy cannot just be solved by one person, but it will need a combination of people's strength, like interdisciplinary efforts for them to come in order to solve that issue. So that's when they can find some maybe how they can solve it. So another thing is further studies should be conducted to make sure that health outcomes are being affected by health literacy. So there is no way to use assumptions, but they should just find if really health literacy affects health outcomes. So that was it about my presentation. Thank you. So on this slide I have the references. So this is where you can get more information about what I've talked about. So feel free to do so. Thank you very much for your attention. I really enjoyed talking about this topic, and I hope it will be helpful to you and you'll be able to take care of yourselves. Thank you once again.